What exactly happens during a stroke? Why is every minute so critical?
As I mentioned earlier, there are two types of stroke. One is when there is a reduction in the blood supply or block in the blood supply. That is called an ischemic stroke, about 80%. 20% are hemorrhagic stroke when there is a bleed. Either the aneurysm, like you say, balloon has ruptured or one small blood vessel has burst. So that is called a hemorrhagic stroke. So when you have an ischemic stroke, it is like you put a dam to the blood supply to the brain. Every minute the blood supply is blocked, the brain loses nearly 2 million neurons.
Oh, permanently.
Lost permanently. So that is the kind of importance and impact of the blood supply to the brain.
Okay, you can't rejuvenate it again.
The only way you can do it is to treat the stroke as fast as possible.
That's the only way.
That's the only way to prevent further damage.
Out of 1,000 people, how many end up with stroke?
Incidence of having a stroke in India, nearly 100 individuals per 1 lakh population. 1 in 4 individuals have a risk of having stroke in their entire lifespan. There is a stroke happening every 40 seconds in India.
A person got a stroke out of nowhere. How does it feel to have a stroke?
The basic symptoms, how to identify stroke, has been given by the American Stroke Association. It is given by the acronym B fast. B is balance. You tend to have a little bit of imbalance. Some people have giddiness. They tend to fall to one side. Then I. There could be either blurring of vision or there could be drooping of one eye. Then F. Your face may get turned to one side. Then arm, weakness in the arms. Suddenly you feel that the arm is becoming weak. You feel it is not having enough strength. S for speech, stuttering, stammering, no speech. These are the main symptoms.
That means stroke has already happened.
It has started.
So it doesn't look like sudden stroke and you lose unconscious and then you're rushed to the hospital.
That can happen when there is a large vessel which is suddenly blocked. Or you have a massive bleed in the brain. Then you become unconscious or comatose immediately.
So that B fast guidelines. So these are the symptoms. They should immediately rush to the hospital.
Rush to the hospital as soon as possible. Time is brain, as we say. The sooner you identify a stroke and you treat a stroke, the better is for that person to recover.
1 minute, 2 million neurons. My God.
Ischemic strokes are mostly painless. Many of us try to ignore it. We say, let's sleep over it. Maybe tomorrow I'll be normal. And we tend to ignore the symptoms of stroke. Whatever B fast I told you, we tend to ignore the symptoms of stroke. Just sleeping over it in the afternoon or in the night and say by evening or next morning I'll be fine. By that time, the stroke would have evolved. Damage would have been done.
I think this information should reach everyone.
It may be a false alarm. For all you know, it may be, but it's better to be safe than sorry.